Am I audible to you, ma'am?
Yes, you are audible. Good evening, everyone. Welcome to Masi Care Clinic. This is our new story which we are starting, Mom Star Stories, where we have our very good moms who have successfully started their journey and they are breastfeeding their babies, exclusive breastfeeding. So today we have Mom Star Radha from Hyderabad. Welcome, Radha.
Welcome. Thank you, ma'am.
Okay, Radha. So I'm asking you a little some questions. So Radha, tell us a brief about yourself.
I'm Radha Kishori. I'm from Hyderabad. I'm a mom of two kids, one boy and a sweet baby girl, whom I'm blessed with on July 18th this year. And she's 3 months old now.
Okay. Tell us more about yourself. You want to tell us something about yourself?
Yeah. I'm from Hyderabad. I completed my master's in microbiology, and I wanted to do my PhD, but I got married, so then I got caught up with the kids,
Mhm.
and now I'm a stay-at-home mom, and
Okay.
I'm with the kids. That's it.
Okay. So, are you wishing to join your work back after 6 months or something?
Not immediately, ma'am, but I have few plans. Like recently, I got this idea of taking a lactation consultants
Wow.
course.
Nice.
It was
Nice.
3 weeks back. I had this in my mind, and I spoke to my husband about it. He told okay, but for that it needs a lot of time because my daughter has to grow up. She has to get independent so that I can take up the course and go ahead with it.
This is so good. This is so good. If you plan
You
to
are
do
one of
that,
the inspiration for,
pardon?
you are the inspiration for that too.
Oh,
After
wow.
attending
Thank you. Thank you so much,
the
Radha.
taking the course.
Okay. So, how was your experience with Dr. Tanima Singhal? That is me. Share us your breastfeeding journey with us.
I started feeding my child after she was born. Only for the first 3 hours, she was given formula. While the stitches were being done, she was given formula. After that, she was sent to the room. Later on, when I went to the room, she started crying, so I breastfed her. I never doubted my milk supply issue, latch and all. I just offered my breast to her. I didn't know how to latch and all. What I did was I just offered my breast to her. Only thing on my mind was just offer the breast, let the child suckle. Because I have learned from my research, from what I have done research on the social media platforms, that more the baby suckles, more the baby latches, the
Hmm.
more supply will be produced by
Yes.
the mother. So what I did was I gave the breast, she suckled. I didn't know how much she took in. It just started off like that. I never gave formula except for the her stay during those 3 hours in the hospital. So then I had issues like all other new moms. I had my issues like shallow latch, then sleep deprived nights, hormonal fluctuations, mood swings. I used to get irritated. My son, 4.5 year old, but he's very hyperactive, and managing both kids at a time was
Hmm.
very stressful.
Hmm.
Initially, 2 to 3 months, I had latching problems. When my daughter was 6 weeks old, she was able to latch on well, but there are few mistakes which I have done which I didn't know, and I had this burning sensation around the areola and the sore nipples. Because of that, it was very troublesome for me to breastfeed her. Then I came to know about Dr. Tanima Singhal through BSIM. It's a group on Facebook which supports the Indian mothers for breastfeeding. So I contacted madam, and she resolved my issue. She actually sent me few videos on how to correct latch the baby, and she understood what mistakes I was making. And then I followed her tips and advice, and here I am. It is fine till now. The pain is not entirely reduced, but it is going down bit by bit. But you need to be very careful while learning the technique, because once you achieve the deep latch, then it will be a smooth breastfeeding journey.
Yes. I think we are just 5 days ago. We started
Yeah.
our journey together. And see, we have got such a good bond that today we are sharing experiences together. That's great. Acha, did you attend any classes or any information during your pregnancy for breastfeeding?
No, ma'am. I didn't do any. I didn't take up any classes for breastfeeding or pregnancy. All I wanted to do was I wanted to feed my baby. I was determined because with my son, I couldn't feed him for few reasons. For only for the first 5 months, and that too he was on mixed feed, like formula and breast milk. And after 5 months, my journey stopped. It was very. I felt very sad. And when I got to know that I was pregnant with the second child, since day one I wanted to feed the child. So I was just going to random information that is available on social media platforms. These days, there is lots of information available about breastfeeding and child care, infant care after postpartum. Most of the information I have learned on social media platforms, just random information. So I was watching few videos on how to breastfeed the baby, but it was not so perfect with me until I consulted you.
Acha, okay, but do you think that during pregnancy, mothers should take a breastfeeding class so that they have good information on that?
Yes, yes, ma'am. They need to take. What I feel is all the gynecologists. I mean, to whomever the pregnant woman goes to, they need to hire a lactation consultant. At least
Mm.
after the delivery, the pediatrician is not completely aware of how a lactation consultant will be, like how the mother should latch the baby, because latching is most important. That is what I learned in this 3 months of my breastfeeding struggle. Actually, the journey comes struggle. It was really tough because it was very painful. Then engorgement issues. So it is. I recommend all the mothers to consult a lactation consultant so that they'll be able to know the various doubts they have regarding breastfeeding. Most importantly, latching issues, and most moms think they don't have much supply. And what I learned on one social media platform, it's a social networking site where the midwife told when the mother is able to nurture the baby for 9 months, she will be able to nurture the baby outside the womb also.
Yes,
That
yes.
was stuck in my mind. And then I felt, yes, we can do it.
Mm. Okay. So as you said that you just scrolled through the information which was on internet, but was it sufficient or you felt that there should be an expert who should always guide? Because it
Yes,
is not easy for every mother to just go and scroll the internet and all that.
yes, ma'am. See, few mothers they don't have access to internet,
Yes.
so in
Hmm.
cases they require a lactation consultant. I just scrolled to the internet, and I told you, na ma'am, I am a MSc microbiology student, so
Yes.
I have entire chapter on immunology. So I know how important it is to feed the baby mother milk, because it is loaded with so much antibodies and so many that infection related issues. It can be it can be, we can
Yes,
avoid
it
those
is more
issues.
beneficial
Yeah,
because it is giving natural immunity to the
yeah, yeah.
baby.
We can
Okay.
avoid with breastfeeding. So I was just researching, and I whatever I knew I learned, and I have started off like that, the breastfeeding journey.
Hmm. And how old is your second baby right now?
My second baby is 3 months old, ma'am. In this October 18th, she'll complete three. So my 90 days of breastfeeding journey will be completed successfully. And I
Right.
feel very happy because I was determined to feed her since the beginning. And then one more thing I wanted to mention is while she was in the womb, I used to communicate to her. Not throughout the day, but every time when I had time, I used to talk to her and tell that you need to take mama's milk. And she cooperates with me very well since the beginning. And so communication with the baby in the womb is also very, very
Yes.
important. Positive
Yes.
affirmation is very
Yes.
important.
I do take classes for Garib Sanskar. It is called as Garib Sanskar, and where we teach the same thing to the mommies, expecting mommies to talk to their baby. And also, can you feel any difference between your both the kids because one is not exclusively breastfed and the other is now exclusively breastfed?
Not much, ma'am. Like health wise, my son is fine. I never had to go to the doctor for simple for issues like fever and all. If it was like very bad infection, then I used to go to the doctor. Or else if it's simple fever and all, it used to be I used to give him some paracetamol at home. Or else he didn't feel ill to a great extent till now. He's fine. Touchwood, he takes all kinds of food. He's not a fussy eater. The only guilt which is with me till now is he was not breastfed baby.
Hmm. But I think
Otherwise,
it was mixed feeding now because you
yes,
said that you gave mixed feeding.
yeah.
Okay. So
And but to
that way, anyhow, the benefits of breast milk will be there with him because he
yeah,
was like mixed fed, and
yes,
more
ma'am.
will be appreciated because your younger child will, as she will grow, so you'll
Yeah,
understand much better like what is the benefits of exclusively breastfeeding. है ना?
yes, ma'am.
Okay. And what message you would like to give to expectant and fellow mothers?
All I want to say is be stress free and make the baby latch onto the breast. Only then the milk will start coming. We have to take all kinds of food which mothers give at home. But most important thing that breastfed mothers have to do is they have to be stress free. They have to drink lots of water, and they shouldn't think that they have low supply. As I told, when the mother is able to nurture the baby in her
Yes.
womb, he'll be able to give the same amount of food after the babies, or at least for the first 6 months she has to breastfeed. So she has to be positive that her milk supply is well. She has to be stress free. She has to take lots of water, and yeah, she has to keep her baby close to her, love her baby, and latch the baby. It is difficult in the initial days. Even I had problems like sore nipples. I had mood swings, then shallow latch, sleep deprived nights. I won't say it is a easy journey. It's all part of postpartum. It's the thing that most Indian women don't know. They think, oh no, I'm the only one who's suffering from
Yes.
postpartum, but
Yes.
this is not.
And when will it end? Will it be ever
Yeah.
like this and all that?
Yeah.
Yes.
And I also had postpartum depression, ma'am, with my son. When he was born, I had postpartum depression, and I got thyroiditis, postpartum thyroiditis also. Only after he crossed the 6 month mark, he started feeling better, and I was able to bond with him. In the initial days, it was just like mechanic life, feeding him, putting him down. I am doing myself, my work, and not able to bond with the baby because of the postpartum depression. I didn't know then. All I used to do was used to complain to my husband, complain to my mother about this, that, this, and I never had to bond with the baby. That is the guilt which remains with me till now. And I want to give the expectant mothers and new mothers a message that this mom's guilt it's not easy to go. It doesn't not so easy to leave. So don't take too much burden on yourself. If there is anything, you can always reach out to help. And most importantly, try to stay stress free, be positive, and be happy in the initial months that God has blessed with a beautiful baby.
Yes. So these are the tips coming from our mother, because you are right now in the journey. So you
Yeah.
know how to like cope up with all these things. Because when I tell mothers that it will go, it will pass on, then sometimes they may be having feeling that okay, your phase passed, that's why you are telling. But a mother who is going through the same journey, she's sailing in the same boat like you. When you give that advice, they will connect it better into this.
The initial 2 months will be difficult, ma'am. It will, because even I went through that phase, and it started to getting better now. It has
Yes.
started to get better. Initial 2 months it will not be good, because we have the stitches pains, and we are in the recovery stage, then breastfeeding issues. All the mothers face that, and even I am one of them. And I have faced all that, and now I am in the third month, and it's going on smooth from now. After consulting you, into my room later.
Okay, okay, okay. Okay, that's good. But now
And
you're exclusively
so I
breastfeeding.
also
That is a good thing, no?
yeah. So Golden Hour, I couldn't feed her, but I made sure that she was fed after I met her in the room, and since then she was only on breast milk.
Okay, great. So today we got good knowledge about what mothers should undergo, because I, being an expert, when I tell them all the important things around, but a mother sailing in the same boat, she connects better in a way. So that
Yeah.
is very good information which you have just shared with our viewers. Thank you so much, Radha, and all the best. Lots of love and blessings to you and your family. Take
Thank you,
care,
ma'am.
Radha. Bye bye.